alignment felt like a topic that had been put to the wayside a bit, but in that sort of dynamic in the market, what we're really thinking is that have we gotten a little bit complacent? Is employment as an alignment model really becoming the default? And is that really a good thing? And I don't know. And we were sort of teasing that question out throughout this research and really pushing and saying, is there a way to counteract or at least compete with some of these other players who are trying to attract physician talent in a way that doesn't just equate to employment? And if so, are we competitive in the incentives and the compensation structures? And is that an environment that independent physicians would find attractive or not? So what is that tenor and what do we need to do to advance alignment efforts moving forward?
When we kicked this research off, I was so certain that what we were looking for and what we were going to find were organizations saying, we're moving away from employment. And here's kind of the mix of how we're going to try to align with providers in our market. And it's going to be more complicated. And there's a little bit of that, but it's usually in addition to employment. Most of the systems that we talk to are doubling down on employment. I think one of the big things pushing systems back to employment is that some of the big forces that, you lump it into PE or payviders or whatever, that physicians were moving to, the pendulum swinging back a little bit. And we're seeing some physicians, it's been 2 or 3 years, they gave it a try. And now they're saying the stability, and I kind of know what it means to be employed by a health system. And the health systems have gotten bigger, more sophisticated. They're taxed better than it was a few years ago. So some because they were pushed by alternative options. And now moving back to employment just looks more effective for providers than it did. And on the health system side, I think it's stability. It's something they know and understand, and it has in many ways done what it was supposed to do, and so doubling down makes sense. At the same time, we're encouraging systems to think about a few things differently within employment. On the incentive side, there's probably options to tie incentives more closely to many of the other things systems are working on all the time that have been tough to move, like access, documentation, patient experience, quality.
What did you hear about physician equity and where is that advancing both with independents and even the physician, those employed within the system?
One of the key early takeaways has been how uncomfortable this topic makes our provider members as we're thinking about the topic of physician equity. As you're alluding to, it's not new, certainly, but it's been top of mind for at least 5 years, maybe a little bit longer, especially thinking about the shifts we see in the musculoskeletal space. Part of that is, the clinical advancements that made it possible to put those joints in an ambulatory surgery center, along with, of course, the policy and payment changes that enabled and in some ways accelerated that shift. And seeing that opportunity, it gave a pathway for kind of independence or even more freedom from getting away from the hospital and health system, right? So that's where it's been simultaneously an evolving opportunity for those independent orthopods, as well as an existential threat in many ways to our health systems that have been dependent on the margins coming from those procedures. While I think I mentioned that's been top of mind for a lot of members, I think the speed at which the providers or really the health system has evolved their approach to health provider equity or physician equity has been a bit slow. Now, this is not the case for everybody, but I think it's been more reactive. Going forward, also thinking through what makes a successful partnership for physician equity is something to keep in mind, because I know we've talked a lot about compensation changing and whatnot, and something to keep in mind here is that physician equity should not be viewed as compensation. It's really a truly investment.
The last big alignment model that really bubbled up, and it's interesting. We looked at, professional services agreements, co-managements, all of those, all the old toolkit is still viable. But the one that continued to come up as something that has been established for many organizations is clinically integrated networks. And that as an infrastructure, a chassis that has been built, say, over 10 years ago now, that in theory was going to serve a major purpose, And some of those are floundering a bit. The infrastructure, the actual entity is still established. There's still physicians participating through their participation agreements, but is it really advancing any of the actual mission and goals as it was set forth? The question becomes, is it worth continuing? And if you want to continue it, how should you pivot it to make it as meaningful as possible over the next 5 to 10 years? So our challenge would be, as we thought through this, thinking through the CIN and saying, A, do we need to either narrow the number of participants and or tier the network in some way that really reflects the overall engagement across providers? Because not everyone is as interested potentially as advancing value-based care as others, and understanding those that are really going to be leading from the pole position, putting them in a position with like-minded peers to advance that in really downside risk type elements, especially in markets where governmental payers continue to grow as a percentage of payer mix. Trevor, is alignment even a real thing at this point, given the limited number of docs in the market that are left to align with?
Our data would say there's a pretty clear pattern that most systems are not that well aligned, especially with their affiliated network of providers, a little bit better with employed providers. I think that means it should be a topic we're talking about, and it shouldn't be something where we feel like, oh, there's a business development team and liaisons. They've kind of got it going. I hope this research is a little bit of a kickstart for some systems to say we probably have an opportunity to push a little bit on the alignment side. I actually think one of the biggest challenges here is what you talked about, Brian, trying to really understand physicians' pain points. And we're guilty of this too. We kind of use like talking about physician language here, like physician alignment, as in we need the physicians to align with our initiatives and our strategy as health systems. There's probably just some little vocab and tee up and how you include providers in that discussion that at least we've heard from systems who are doing this pretty well goes a long way.